So first of all, I just want to welcome Dr. Annette Patel. He's a great partner and friend of the LGS Foundation and the LGS community. He's the Section Chief of Neurology and Associate Medical Director for Quality Improvement at Nationwide Children's Hospital. He's an Associate Professor for Neurology and Pediatrics at Nationwide Children's and the Ohio State University Medical Center in Columbus, Ohio. If you have any questions, as I said, you can, at the bottom of your screen, you can ask those questions. And I will now mute myself and hide my view. And Dr. Patel, take it away.
Hi, thank you, everybody. Jen, thanks for that great introduction. And thanks for sharing your afternoon wherever you are with us today. And I hope that you'll find some of the information valuable. You know, one of the things I thought I would do is kind of address three major topics and then kind of go into some questions and answers. I do want it to be interactive, and so I would love to hear from you guys as questions and concerns you have. But, you know, the idea of how to manage Lennox-Gastaut syndrome in our current COVID-19 pandemic is obviously been near and dear to my heart. Many of my patient population have Lennox-Gastaut syndrome. And therefore, you know, this topic is super important to them and their community at large and your community at large. And so, you know, one of the things I've been trying to do is peruse as much of information that is out there as far as what's available around epilepsy and COVID-19. So I'm going to talk a little bit about high level information and some publications that came out, and then let you guys know there's some ongoing work that hopefully will add to this population. But right now there's a article that just got published in Epilepsia that looked at the Chinese population since they were on the forefront of the COVID-19 pandemic. And what we saw in that population retrospectively was there did not appear to be an increase in acute seizures as it relates to those who had epilepsy, you know, considerably more than their baseline. As you all have lived with and know, any patient with Lennox-Gastaut syndrome or epilepsy can have increased seizures with febrile or any illness, but this one does not appear to be any different than that, which I think is important. I think the other thing that we're learning is that there was a neurology manuscript published by Jackie French and some colleagues, and really that one was a consensus document for providers across the country on what are some important aspects of care and what are things that we should be cognizant of. And I'm going to highlight some of those things in our next part of what you guys and what we can do as a community to help keep our children and loved ones with Lennox-Gastaut syndrome safe during the pandemic. But lastly, it's important to know, though, that it does not appear that our kids are at increased risk for a significant exacerbation of their seizures. And I think that's important. We are trying to gather that information. There's a survey that went out, and we did a preliminary analysis. This is a survey we sent out to all epilepsy providers, as many as we could reach across the world, not just the United States, but France, Italy, Spain, China, etc. We've gotten so far over 100 responses, and basically from there, what they're seeing, you know, which is it's one view of it. It's not obviously everybody's view, but it's one view from the provider standpoint. They're not seeing significant things that concern us as it relates to epilepsy and the COVID-19 pandemic. You all have heard there are neurologic complications of COVID-19. We do not think if you have an underlying neurological illness that you're more predisposed to some of these other issues. So I think that's important information that hopefully will comfort some of you, but there are obviously some manifestations neurologically of COVID-19. They may be loss of smell, loss of taste, which they appear to be temporarily at this point, but also understand that those symptoms can also be present in any viral illness. It's not literally specific to COVID-19, but even influenza and some other viral infections can give you loss of taste or loss of smell. Headache and some increased risk for stroke has been seen in patients with relatively good health. So that's a complication. It's a minor one and it's a small one, but that's one that's being followed and monitored closely, which is very important. But those are obviously neurological manifestations. And then the one that concerns, I think, everybody is encephalitis or meningitis. And yes, there are some cases of COVID-19 kind of penetrating that blood-brain barrier, but again, not at increased risk for our population that we're caring for. So it's the same risk that we see all over, and overall extremely mild. But when we talk about later what we can do to keep everybody safe during the pandemic, that's going to be important, because one of the things we recognize is, many patients with Lennox-Gastaut syndrome will have other medical conditions that do put them at increased risk for complications from COVID-19. And the biggest ones that are out there are high blood pressure, obesity. Those tend to be really big ones that we can kind of see. Diabetes is another one. For adults, it could be asthma or significant respiratory issues. And again, many of our Lennox-Gastaut syndrome children and adults do have some of these issues. So it's important that we're cognizant of that issue, not necessarily always related to just the seizures, but the whole company that it keeps. So it's important to keep that up there. But as we get information from the survey, we asked about patients with DEE, or developmental epileptic encephalopathies. So obviously we wanted to cast the umbrella for not just kids with epilepsy, but we wanted to see what is the world's experience with COVID-19 and developmental epileptic encephalopathies. So we'll get you that information when available. I can tell you personally, we've not had any Lennox-Gastaut syndrome patient test positive for COVID-19 in my cohort here at Nationwide Children's Hospital in Columbus. Overall, we've only actually had 6 kids test positive in the hospital of over close to 300 testing that has been done. So luckily, children seem to be at less risk, which is a very important thing. Now, I want to shift a little bit. I want to talk about what can we do, as patients, caregivers, those that care for kids and adults who have Lennox-Gastaut syndrome. And one of the things that we want you guys to know, and what we all need to know, is there are certain things that I think are going to be important. We're all shifting to telehealth, and I'm going to talk to you about how you can prepare for a telehealth appointment. But one of the important aspects, and I know these seem common sense, but when we're stressed and having a lot of anxiety, especially with our kids being home now and trying to manage our new life and new normal, these things sometimes need reminders. And the biggest ones is making sure your children's anti-seizure meds are filled and you have enough on supply. We're not really significantly having a shortage that we're seeing overall. I'm sure that there might be reports here and there, but nationwide, we're not having those problems. And a lot of the manufacturers of these medications are really being cognizant. Sorry, I thought it was muted real quick. But one of the things that the manufacturers is they're trying to be cognizant to make sure that the supply is there for those that need it. But it's really important that you pay attention to your prescriptions. And when able, if you're getting low without refills, give your providers even additional time, because we're getting inundated with a lot of phone calls, because that's about all we can do now. We're not seeing people live very much. And so the number of calls are increasing, and so therefore we want to give our nurses and providers time to be able to get those prescriptions refilled. The other thing I think is really important is check your rescue treatments. Make sure you have your rescue medication on hand, you know how to use it, you don't have any questions on it, and that it's not expired. Many of the older medications do have a shorter expiration date, and so it's important that you look at your rescue therapy, and if it is expired, call your neurology provider to get it refilled. There are newer products that are out there now, so this might be an opportunity to simplify your rescue treatments, but that's a discussion you may want to have with your provider separate from our discussion today. But again, it's important that you have that on hand. What we're trying to do is really have any opportunity to keep you and your patients and the caregivers and loved ones at home. Because remember, it's not just the patient or child with Lennox-Gastaut syndrome that we're worried about. We're also worried about you as the caregiver and the exposures that you potentially can have. And so we want to limit that as much as we can. And we know the emergency department is fraught with tons of potential for infectious passing of things. And so we do want to limit that. And these are just some tricks of the trade that we thought are important. The other big thing is an updated seizure action plan. I hope many of you have seizure action plans. For my adult caregivers that are on the line, I recognize that's a relatively new concept that we're hoping to change moving forward. But for pediatric neurology patients. I hope that's a part of your plan, because it's really nice to have a document to know, okay, here's what I do in this stage, this stage, this stage. And many of that is done obviously when your child is at school and informing them, but you're the caregiver now and you're the teacher. And so sometimes it's nice to just have the document to remind yourself, okay, here's what I'm doing. Here's what I need to do. So it's kind of nice.
Dr. Patel, if I could step in, I have two questions that I thought might, certainly the first one, Karen was from Karen Groth, and she said, you know, when her son is hospitalized, they're always with him to ensure he is treated appropriately. And she said, I'm concerned about the potential for being separated from him should he need to be hospitalized or treated in the emergency department during the pandemic. Do you have any advice about this so that we help with his care?
Yeah, and that's a good question. Hello to Karen. I know Karen, so hello. It's good to have another Columbus person. But the important thing is one caregiver can always be with the patient. So it's important that you think of that ahead of time. Which of you are going to be the one that goes with your child or loved one with Lennox-Gastaut syndrome in the case that they do need to go to the emergency department or even be admitted. That's going to become more important as we start to slowly open up in facilities in certain states. So here in Ohio, we're going to slowly open up elective procedures and elective opportunities. We're going to try to not have you stay overnight if possible, but there are those situations. For example, you know, elective outpatient EEG is now going to be more of an option, but still there's those limitations. You definitely want to have your masks. They're usually going to be available at all your healthcare institutions, but you want to wear masks when you're present in those environments. And remember, when you wear a mask, it has to be covering your nose. It is not beneficial if it's not covering your nose. Now, the mask is not for your protection. The mask is for protecting others. Nobody knows what exposures that you've had, and therefore it's all of our responsibilities to protect each other, and that's what the mask does. So that's also very important, that when you go to healthcare facilities and you start to have these interactions, that others are wearing their masks to protect your child. That's going to be important. And again, that's another important aspect of what we can do, is if we're going to go out in public, let's be the example for the others. You know, again, it's not going to be super important that your child wear a mask to protect him or her, but it's to protect everybody else they're coming in contact. And remember, we're also trying to limit exposures to you as caregivers. And so, you know, anything we can do, we're going to do it together. So that's a really good question. Did you have another one?
There's a follow-up to that as well, where somebody actually mentions an issue with an adult with LGS who was not allowed to have a parent in New York City. And so I guess, is this, when you say if one person can attend, is this something that's supposed to be across the country, or are you just talking Columbus specifically?
Unfortunately, it's very specific, not even just city specific, it's institution specific, knowing that policy. But I will say, in cases like you're mentioning, it may be helpful to get a letter from your neurology provider that says one person needs to be with my patient or caregiver, you know, due to intellectual issues or disabilities. The other big thing that we should mention while I'm on the topic of masks and patients with LGS is there's still some controversy on, you know, we should not leave our LGS children and adults alone with a mask on, only because they need to have somebody else remove it if they were to have a seizure. And so it's important that if you're asked to not be with your loved one, that perhaps the mask may not be a good idea, because we do want them to be able to breathe adequately. And so therefore, if they were to start to have an epileptic seizure, they must be having somebody else to be able to take that mask off. So those are some important things to consider. And again, can help justify why you need to be present with them in the hospital. I think if you got a letter from your provider, that should cover it. And as long as you limit it to just one person, I think you should be okay, I hope. But again, that's very institution specific.
Well, when I think of my own son, I don't think he would wear a mask, and he drools like crazy. So it really, the optics of that are not that great for people who are looking at this drooly person not wearing a mask and thinking he should be, somebody should be doing something about that. And of course, he's going to rip that mask off his face.
Yeah, and I think that gets some other points I wanted to bring up, to be honest with you. I mean, I think some of this is common sense for those that have lived this journey for a long period of time. I mean, I'm probably not teaching you guys much or new, but I know it's hard right now, and I know it's difficult not to be able to go outside, but I definitely think following your stay-at-home orders are of utmost importance, and if any interactions you can limit, I think are only going to benefit your child and everyone else, to be honest with you, but more importantly, your child and you. So I think that as we start to loosen up restrictions, parks are going to become very important. I want kids to be able to get outside. But one of the things I think are important right now is set out, if you can, virtual play dates or virtual what we call happy hours or virtual situations. Many of us, obviously you guys are very savvy, you're on a Zoom call right now. So, I've utilized that for a lot of my families to where, they're getting in touch and together with other children or other patients with Lennox-Gastaut syndrome or even other people that they interact with in their school setting or socially, because I think it's really important that we don't forget the importance of socialization for our children. And that's true of anybody. And I think more importantly with kids who have Lennox-Gastaut syndrome, it's very important that we understand how important those aspects of care and life can be. And that goes with the school too. I think one of the other things I want to pass on to this today is please make sure you connect with your school. Many of my families I'm hearing are feeling a little left out with this homeschooling atmosphere that we have. And that's not right to me. There are regulations and rules that are in place. There's a really good webinar on the Child Neurology Foundation around this. Many of you know Monica Jones with the Brain Recovery Project, and Monica did a very nice, she's a lawyer, and she and another person did a very nice webinar on what we need to understand with children who have neurological disorders or intellectual disabilities as it relates to school and what they should do and shouldn't do. The important thing to remember is I don't want our kids left out, okay? I don't want this to be, oh, now that we're homeschooled, thanks, good luck to you. We're gonna take care of everybody else. Your kid isn't gonna get any of the resources the other kids get. That ain't right. I'm not saying I can do something about it, but I definitely wanna bring it up and mobilize the army of getting it done. But it's important, these things are really important, and I really can't stress the issue enough. I mean, unfortunately, people can be very cruel and mean and misinterpret that situation Jen just mentioned up. And I don't want to put you guys in harm's way. So if we limit those potential interactions, I think we're all going to be better. I mean, look, I have a huge beard on. I haven't even left my house in like 3.5 weeks. So, I think we're all in this together to do that. But virtual play dates, I think, are really helpful. And the other thing I would say is communicate with your neurology provider. We're going to talk about telehealth, but we're here for you. We're not going away. And we're going to try to find the best way we can care for you guys in this setting. And so please reach out if there's other issues. Even though therapies, for example, may not be done in person, you can still do remote therapies. There's ways to do video telehealth therapies, speech therapies. So there are ideas out there, even if it's school-related things. I know our neuropsychology team are calling parents and talking through with what they can do to help our children while they're at home, and then our developmental psychologist is doing the same for those that have severe, intellectual impairment. So it's important, but ultimately put yourself and your child in a situation that will avoid needing to go to the ED as much as you can. I know that's not easy for all of us, and it's easier said than done for many of us, but that's why having that communication with your provider first before going to the emergency department is very, very helpful. The last thing I wanted to talk about around, what to do to keep your child or loved one safe with LGS is, remember, we're also kind of looking at routine lab testing differently now and routine EEGs. You want to ask yourself a big important question. How important is it that I get X? And in our case, it's lab monitoring, for those that are on medications that require it. And I've really put a backstop, and I'm not saying that everybody can fall into this, but I've really not pushed that envelope very far because I don't want to get people exposed into a lab setting. And so one of the things you can do is just review the side effects of the medication so you can start to look for them a lot more closely. That might indicate perhaps your child or loved one needs to get lab testing done. So one of the things I would do is, if you start to see those things, communicate with your provider first, like, hey, I'm noticing XYZ. Does that mean I should go get labs? and then they can obviously get back to you and see what that's all about. But if they can be postponed safely, I highly recommend that at this point while the risk for being exposed to COVID-19 is still high. So before I shift over to the last section, and I know we're going to have plenty of questions for at the end as well, but I want to talk about how to prepare yourself for telehealth. Are there anything else, Jen, that you want to cover before I move on?
Yeah, before you move on, there was just one earlier on when you were talking about the children that who did test positive in your hospital. There was a question asking if you could share the age range for the children who tested positive.
Oh, yeah. The youngest was a 5-year-old and the oldest was like an 18-year-old. Yeah.
And that's it, right?
Yeah, and they all did pretty well. I mean, I would say one of the 6 went into the intensive care unit, but then they're doing pretty well. So that was another comforting sign. And none of them have epilepsy, by the way. None of the 6 that tested positive have epilepsy. We've had 0 epilepsy. It's been amazing, which is good. That's what I want to see. Anything else as it relates to what we talked about? Again, there's going to be plenty of time at the end to answer all questions, but I'm going to pivot about preparation for telehealth.
Okay, and I think just on that one, somebody just asked an additional question. How did those children present with, what sort of symptoms did they have?
So most of these children had significant respiratory symptoms. So that's how we actually recognize them. They had troubles breathing. One of them was asymptomatic because we just started testing everybody in the hospital and they had no symptoms. They were there for something totally unrelated. But it was otherwise very obvious that these are the symptoms that we've been tracking. Shortness of breath, coarse cough, dry, sore throat, those kinds of symptoms. And they were pretty healthy kids. And again, most of them did really, really well. Now I want to, though, shift, if I can. I want to help. I think it's important that we're all prepared as best we can for telehealth. I imagine many of you either have currently experienced a video or telephone visit with your neurology provider or may have one upcoming. So I think it's important that we share some of the tricks of the trade that we found is very helpful. One of the things I love about telehealth for this population, by the way, is I think a lot of kids with Lennox-Gastaut benefit. I mean, how many of those patients we have are in wheelchairs that it's hard to get, from point A to point B, then up an elevator, in a garage, all this other challenges. It's been nice not having to have their child leave their house, and they're sometimes more comfortable in their home setting. So for me as a medical provider, it's been nice to be able to see, who your child really is or who your loved one really is. And I think that's been very nice. But please know that it's getting better, but we all need to be patient during this process because there's going to be a lot of issues. We're all pivoting significantly to do televisits, and some of us are being able to do them quicker than others, but it's a new frontier, and for many, it's never been done. And so I think that patience on both ends is going to be really important. We did do a webinar I really want to highlight through our partners and colleagues at the Child Neurology Foundation that should go live soon on this. In that webinar, it was me and one of my patients' moms. So it's kind of nice because we've known each other for literally 9 years, taking care of her daughter. And so we were able to talk about how we do telemedicine because even before COVID-19, obviously they live far away in Indiana. And so therefore I had to communicate their care via the phone sometimes. And so we were able to kind of share some of our experiences. So look for that, that's coming out. But one of the things we talk about, and I'm going to highlight many of them for you here today, is if you have a patient portal on your electronic health record through your neurology provider, sign up now. So many of us use Epic, and for that it's called MyChart. So I highly recommend that you kind of go through those steps now before it gets to your appointment so you can triage any problems that you have. If you can, test the video software. Epic in our institution is using Zoom, so it's similar to this, but that's not always the case at all institutions. So really, give your provider a call and see what they're using and how to best get that set up. I do recommend that you pick a quiet room with decent lighting. We want to be able to see the child. So it's very important that your loved one with Lennox-Gastaut syndrome is at least present for part of it. And we'll get to ways that I'm going to use you guys to help us examine the patients. So I'll get to that in a little bit. But the other big thing is if you can use a computer with a video cam, that's what I'm broadcasting from right now on my Mac. It's helpful because it's a little bit better connection. And if your laptop does have a direct connection through what we call an Ethernet cord to your modem, so you can have a better, more stable internet, that would be ideal as well. But again, with good Wi-Fi nowadays, it's not as important. So don't feel like it's imperative that you do, but these are just little tricks. The other thing is if you're not able to use your home internet or Wi-Fi and you're using your cell phone minutes, just be careful. These are longer visits sometimes, and so therefore you may chew up a lot of your minutes, and I just want you to be careful that you don't go over or you're cognizant of that, because it could get really expensive for you, and I don't want to see that happen. But always have your phone or cell phone available, and make sure your medical provider has that number handy, because we've seen some of the videos fail because of internet connections, which aren't anybody's fault. It's just the reality. And therefore, sometimes I've had to pivot and pick up a phone and say, hey, can I just call you? Sometimes the audio range is not very good or the audio feed isn't good with the video. So I've muted the audio, but still kept the video and just called folks on their cell phone. So having that there is also really beneficial. And again, if you could use a separate device for the actual video telehealth visit, that is an ideal situation. The other thing you need to remind yourself of is you will provide written consent or verbal consent to allow us as medical providers to do that visit. So it's important that you're ready to be able to do that and you understand why. One of the things that's important, I mentioned earlier, is that you want your patient or your loved one present. And the reason why is I really can see a lot, and I can do a lot from just seeing your child or loved one on a video camera. So I can do some of the examination, but I am going to need your help. You know, for those that I need to see some of the patients move their arms or legs or even walk, that's where you're going to have to help me come in and do some of those things. And so having that team atmosphere is helpful. Sometimes that's challenging when it's only one provider and one patient, and you're trying to navigate your, phone and do the examination. So again, it's helpful to have a separate device like an iPad or a tablet of some sort, or a laptop or a desktop computer. I know there's some concerns in the community about privacy. Please note that medical practices have really had to do this as private as possible, and Hipaa protections are in place. We are not recording these visits. They're not stored anywhere. Nobody else is going to see, the inside of your house. I mean, you're seeing inside of mine. This is on my office, but you won't have to worry about that. So there's that. I know that there's been some issues earlier on with Zoom, or what they call Zoom bombing, where people are coming into some of these secure visits. But as long as your healthcare facilities is using a secure line, which you're really required to do, you shouldn't have any problems with that, and it should be okay. One of the ways you can protect yourself, though, is obviously, do it through the patient portal, because then that's secure, and that is for sure the best way to do it. However, if you're not comfortable with video, people may not be comfortable inviting others into your house. It's okay to request a telephone-only visit. We are able to do those, especially for the patients that we've cared for years. I could get on the phone and call you, and you and I can kind of talk about what we have concerns about and be able to do most of it okay. I find personally the video is much more efficient from the standpoint of being able to actually see the person who has Lennox-Gastaut syndrome and other epilepsy syndromes. But again, that's going to be up to you. One of the biggest things is write your questions down. These are new visits. You're not comfortable with this. So it may be a little anxiety or stress producing. And so writing your questions ahead of time, I think, are very helpful, but then prioritize them. For whatever reason, if the video or telephone feed gets cut halfway through, at least the majority of your important ones are covered at the beginning. So definitely want to think about that as far as prioritization of your questions. Those are really important. One other big aspect, and then I want to turn it over for questions, is really the billing. Okay, so it's important. Not all institutions know how to handle this. So even if you get a bill, call your provider or your healthcare facilities and say, was this really intended to do it? And if it was, are there ways around it? You may want to call your insurance carrier to see which exactly is covered. The rules have definitely been relaxed, but unfortunately we've heard stories, mostly in the national media, of people getting unexpected bills. And so it's important that perhaps your insurance company know, or they let you know what exactly is covered and not covered. Some, it might be just the video telehealth is covered, and some may not be for telephone. The other big issue that we're having is state to state. If your neurology provider is in a separate state that you live, you may not be able to do telehealth. That's a restriction, and it's all individualized between relationships from state to state. For me, for example, I live in Ohio. We have a lot of neighboring states where I see patients from. Pennsylvania right now is about the only state that borders Ohio that I'm able to actually do this video telehealth visits for because of the government restrictions in the bordering states. So Indiana has said no to us right now. Kentucky, Michigan is allowing us, I guess, and Pennsylvania is allowing us, and West Virginia said no. So this might not be an option for you, and I think that's an issue. As we start to relax the clinical visits, that's where these safety precautions are going to be important. So you definitely want to keep up on what your state is mandating and what's recommending. Importantly, I feel, again, and I said this earlier, if your child is going to be around other human beings, I would prefer that those human beings have masks on, because again, we're trying to protect our loved ones, and the other folks, we don't know what exposures they've potentially had. So if they're wearing masks, that limits the exposures. As always, we definitely want to limit patient or contact. So if you are in open areas, once relaxation comes, try to keep others away from your loved one with Lennox-Gastaut syndrome, because I just think it helps minimize that risk. We do not want our kids to be in isolation. I recognize that. But again, we want to be safe and keep them safe as possible. I do hope video telehealth is here to stay. I think it's going to be a good option for many of our population. So we'll see what that looks like. I will say right now, we don't know the answer to that. There's a lot of folks advocating for this option. So if that's something you as a community at LGS like, or you as an individual like, please write your representatives and tell them how important it is to have this continue post-COVID-19, because obviously your voice resonates, and that's what we're here to do, is take care of you. So I think I've covered a lot. Sorry, I gabbed on for a while, but there's a lot of things I wanted to kind of cover, but I'll stop and open it up to questions if that's okay.
Oh my gosh, no, that was so much great information. Actually, there was one, Lisa had mentioned, just in reference to you're talking about minutes and the expense. She said that some cell providers may waive overages. And I think in this current climate, I would say that any kind of regular charges you're getting for just about anything, you could really appeal it, because there are a lot of exceptions being made in, even outside of the medical arena. So
that's a great suggestion. Thank you, Lisa, for bringing that up. Yes, I agree. And I know it's hard, you guys, because I mean, you're busy, you've got a lot going on. Trust me, it's not an easy thing to do, but anything that you can do to make sure that these charges were intended or could be potentially negotiated are very important. We're all struggling here, and so it's important that anything that can be done, be done.
I was also going to say, people just start entering your questions if you have them. And since I don't see one right now, I'm going to ask one, or actually make more of a comment. When you were talking about schools and inclusion, I'm really glad you mentioned that the webinar with Monica Jones. I also had my own son's IEP last week, which was great, because I discovered that a lot of the things that are really important to me, which is his inclusion in the general education population, he was not being given that opportunity. And so I mentioned it, and he is now going to be able to participate in some of those classes, because if it's part of his regular curriculum, then it should be part of, it should be an ongoing thing.
I agree. I feel very strongly about that. I mean, just to give you a little bit of more background on that, I do have a call upcoming with the American Academy of Pediatrics, Child Neurology Foundation, Child Neurology Society, and American Epilepsy Society. We're all trying to make sure that we have resources available for everybody out there and things that they could do. There are some that are available on AAP websites for you guys to look for, Child Neurology Foundation, whatnot to link to, but we need to make sure that our kids aren't left out. I mean, it's important that they be treated the same way they were being treated with, obviously some restriction given they're not present, but still, whatever IEP was placed at school is best that we can apply those things while you're doing homeschooling is super important. And it really, again, I cannot highlight the need for socialization. I know now that's the third time I brought it up, but whatever you can do as families and caregivers to make sure, your kids are not being completely isolated is great. I mean, it's just such an important thing right now. And even as a community amongst yourselves, I think it's really important as caregivers that you don't also isolate yourself. You got to take care of yourselves, moms and dads out there. It's hard. It's really, really hard. But if we, and some of you have heard me say this, if you can't care for yourself, you're not going to be able to care for your child the way you need to. And so make sure the best you can. And again, I know I'm sitting here saying that, and it's easier said than done. I recognize that, but even your socialization is important.
That's actually really good advice, because most of us are willing to give it to one another. We just don't take it ourselves. Okay, there are a few questions here. The first one, I think you already may have answered it, so maybe this attendee started a little late. She wanted to know if any of your patients with epilepsy developed COVID, and if so, did they have an increase in seizures? But you said no to that.
No, none. I've only had one patient who's in his home setting with COVID-19, but he has very easily controlled epilepsy. And so he hasn't had a seizure in several years. He's one of the few kids I see that actually, are just are that way. And he hadn't had any problems with it whatsoever. Yeah. It's interesting because he was literally asymptomatic in his home. The only reason why he was tested was they just got back from Italy and said, well, shucks, we better check it out. And they're like, oh, you're positive. You can't go out anywhere.
Yeah. Well, for once, I'm glad I wasn't in Italy. Only once. So in your opinion, do you think telehealth appointments should be considered to supplement face-to-face appointments after COVID-19?
I think it's all going to depend on each individual situations. I do hope that for those that are traveling long distances, I'm going to be able to continue video telehealth. And then when there's a concern that I can then pivot to be in person. If you have a rash that you need me to see, I can see it, but sometimes, I may need to see you in person, or, an exam finding that you're concerned of as a parent. For new patients, I think it's still going to be kind of difficult post-COVID-19 to do that remotely. It's still possible. But I do feel it's going to be important. And I think for my population of patients, at least their families it's going to be really helpful. I mean, because it is a struggle to get place to place, and especially for those that are in wheelchairs, that are non-ambulatory. I mean, it's hard, you got to park, and then you got to navigate the system. You got to go find the room, and then you got to look. I do feel we're going to live a different normal. One of the things I think are important to remember is I want you guys to be healthy no matter what, whether it's COVID-19 or the next virus, influenza, RSV. And a lot of the measures that we're putting in place right now are actually really good ideas in general to help kids safe. And so, if you're concerned about exposing your child to just illness in general and can take these precautions and continue with video telehealth without compromising the quality of care, I encourage it. But it's got to be what you feel is comfortable, okay? If you as a caregiver do not feel comfortable in that setting, then that's okay, but if you do, I think it's going to be a really big advantage for many of our patients. So I'm excited. I really want it to continue, and I hope it'll be part of my care moving forward. I really do.
Next question from Melanie Huntley. For those of us with nonverbal and developmentally delayed LGS loved ones, how do we determine if they are having respiratory symptoms? If we have at-home oximeters, what should we look for in those readings?
Yeah, great question, Melanie. And I think that's going to be the biggest issue of why I think whatever you could do, keep your child safe and limit exposures because of the difficulty that you may have being able to recognize some of the symptoms. But if you have a child and you don't need one per se if you don't have one, but if you do have an oximeter, what they've seen really is readings down as low as in the 60s, so significant respiratory issues, and they're more consistent. Now, If your child is below their baseline on a consistent level, then you should at least call your primary care provider to be sure. They're going to have a lower threshold perhaps to test your children compared to others. So just have that kind of unique or constant communication back with them. Other things to look for are blueness, chronic blueness that's not associated with seizures around the lips and mouth has been seen. And I don't know if you've heard about these things called the COVID blue toes syndrome. So in between the webbing of the toes, they're starting to see where there's some bluish discoloration that won't go away. And that sometimes is related to COVID-19. So those are some of the subtle signs to look for. If you see anything of concern, take a picture, take a video, send it to your provider. I think what's really awesome about the epilepsy population is we're used to this, right? Many of us have you upload videos for us to look at of different events to say if they're seizures or not, and that shouldn't change in this world. But also for your primary care providers, they're now more used to this, looking at videos and looking at uploaded videos. Many of the portals will allow you to upload your videos directly, securely. And so therefore is a nice way to do that. We've started to do that with our MyChart venues, where we have people upload their videos straight into MyChart for me to be able to review. I just click the button and boom, there it is. What's also nice about that feature is then if you want, I can leave it there. So if I have to, look for it in a year and say, remember that event he was having 1 year ago? Oh yeah, he's having it again. I could go back and look at that video from a year ago just so I know what I'm looking for. So there's advantages to that. But again, biggest thing I would say is if you've got consistent concerns or symptoms, just have that conversation with your primary care doc.
Thank you. Okay, here's another question. I am a home health therapy provider with a child with LGS. There's a possibility that I work with patients that have COVID. I've taken a leave of absence from work to decrease my son's exposure. How long do you think I should do this? Well, that's
great question. I think, unfortunately, I don't have a great answer for you. It obviously depends on where you live. One of the recommendations I would have is look at your state's trajectory. So in Ohio, for example, we're starting to see decreased cases per day. We're still seeing cases, but the curve is no longer going up. It's starting to come down a little, which is very nice. So we're able to start to consider loosening restrictions. But here are the biggest things you want to keep in consideration if you want to limit exposure. What is currently happening in my state as far as the numbers go? What measures have been put into my place in my state that have been preventative? And then number 3, are people really following these or not? For those of you that live in California, I just saw this horrific picture of your beaches reopening, and it almost brings me to tears about how many people I see on these beaches because we're not getting it from that standpoint. So if you're living in one of those states that haven't really taken the necessary precautions, your window is going to be a lot longer because the number of cases that you're going to see are going to be still in your community for a longer period of time. The other thing you can do, obviously, is if you're a healthcare worker or have to come into interaction with patients or people that might be exposed, is make sure, you're obviously wearing a mask to protect them, but make sure they're wearing a mask. Make sure that you're doing everything you can to social distance where possible. And so, for example, touchless opportunities. So in therapy, it's obviously difficult. I recognize that, but you will want to have gloves, and you're going to want to change your gloves in between patients. Masks are different. They're not, you don't have to do one and done because remember, it's your exposure, but the gloves are what you touch. So you want to do that. The other thing you could do is have a change of clothes in your new change of clothes. So when you leave for the day, put a change of clothes right where you come into the house, immediately change, strip down, shower if you can, but if not, at least get rid of the clothes that have been touched by others that have come in contact with you. And so one of the ways I do that is, again, recommend having a set of clothes right where you come in and out each day. And that's the first thing that you do. So first thing you do when you leave is you drop them off. First thing you do when you come home is you swap them out, and then you can wash up. So that helps. So that will help your limiting. And then, wash your hands well before you come in contact with your child, or some of the tricks of the trade. If you feel your child needs to wear a mask in your home setting because you're at you're literally at high risk of being exposed to COVID-19, that's okay too, because remember, we're protecting each other. Sorry, I meant to say, or you need to wear a mask in your house for that reason, not your child. But then you may want to wear a mask. But again, that could be troubling to your child to see you wearing a mask all day. They may not like that. So you got to balance it out. But those are some of the tricks that we're trying to employ in the healthcare facilities. If you have somebody else that can provide the majority of care for your loved one with LGS while you're doing the lion's share of the work, which we do appreciate and we know is very important, that would be also very good as well. I know and I recognize that's not always able to be the case for many of you. So hopefully some of those tricks are helpful.
Thank you. Would you, yes. Would you recommend we work through primary care doc or neuro should our child present with COVID symptoms?
Oh, definitely primary care. Very important that you go through primary care first. Unless you're having increased seizures or neurological complications. Otherwise, I think you'd be wasting time. I've learned a lot about COVID only because I've had to, but I'm still sending most of my COVID non-neurology questions to primary care.
Okay, and right now, I don't see any more questions. I don't know if you do have more questions, please type them in now. As you can see, we've been joined by my co-host here, and he's having a great time. And yes, I am in California, and I went for a walk on Saturday, and the beaches were packed. It was pretty scary, actually. I thought, how can you keep people socially distant? And we're in a heat wave right now, so I get it. I get why people are doing that, but it's not a good idea. You just received a thank you.
Go ahead. Sorry, I was going to say.
Somebody just said thank you so much for doing this.
Yeah. And I wanted to make a quick comment. I think that what I've recognized and learned is we can only control ourselves right now. And we're not out of the woods yet, guys. We are not out of the woods yet. I wish we were. Okay. I wish we can have it back to normal, and we won't for a long period of time. This is going to be our new normal. It may get more relaxed, but the important thing to remember is control what you can control. We will get through this. We will make it. We will be fine. I promise you. But we're all going to be, we're going to perform common sense approaches. And I have no doubts that this community will rally and do the right thing for each other. I have zero doubts. I can't control somebody else's behavior, but I know I can recommend things to this group, and they're going to do the things that are necessary to keep everybody safe and take the necessary and serious precautions that are out there. So I know it's struggling, it's hard, and it's more challenging in this world. We will keep trying to educate everybody. So as that survey comes out, if there's information that changes, we will update folks. One of the things I have been impressed about throughout this last 7 or 8 weeks is what I've seen as far as rallying in the communities. Your communities are rallying to support you. Weekly, now it's going to go to every other week. We've had calls from representatives of the epilepsy community to be sure we're all working together, we're collaborating, we're coordinating efforts, we're not duplicating, we're throwing politics out the window, and we're just doing what's important, taking care of patients and families with epilepsy. So the AES, CNS, AAN, I could go on and on, NAAC, ACNS, all these organizations have come together. And we're putting resources on our various websites, and we're trying to link to other resources as well. So you're not in this alone. I think that's one of the important messages is that we're here for you, and we are trying to stay on top of everything the best that we can.
Thank you. Yes, I think I'm also, when we were talking about keeping our kids safe, I'm reminded of Tracy Dixon Salazar last week did a webinar and mentioned how her own older son is in the healthcare community. So he's not coming over to their house. Yeah. And I know that one thing that a lot of our families need, my daughter lives in Los Angeles, but I'm in Santa Barbara, and she came last week and then went back to LA, and now she's back. But I really need that help with my son. And it's nice to have her here. But at the same time, I have to be very careful letting somebody who's going into a different community, I just have to have some sort of reassurance that when she's in her home in Los Angeles that she's by herself.
Mhm.
Sure, a lot of us have that kind of dilemma where, you know, even if we need some support, are we allowing some of those supporters into our homes, like nurses and others that normally come into our home, that we're having to do it all ourselves?
And I think that's important because, you know, there's a balance there, right, Jen? I mean, you know, you also need help, and we recognize that. And so, you know, as long as those people are able to do things safely, then it's okay to receive that help. And it's okay to receive help in general. It's okay to ask for help. It's okay to get help. You know, we can't be doing all of this on our own, but just we ask everybody to be as safe and as possible, and really just approach it from a common sense perspective. I mean, I don't like seeing some of the things I see out there on social media or on regular media, and unfortunately there are just some situations you can't control. But if we, you know, have good people in our lives and we're inviting good people to be a part of our life, then hopefully they'll do good things and make the right choices for our kids.
Exactly. Okay, we have one more question here. Oh, first of all, comment. This was phenomenal. Thank you so much. Hope you and all your families stay safe and healthy. Thank you, Robin. And now Delinda said, in regards to lab testing, should parents refrain from taking our kids in for labs to verify liver function and blood concentration levels? Should we consult with our neurologists?
Yeah, you should absolutely consult with your neurology provider on how important it is to get that now versus waiting. One of the things that I've done, at least in my own personal patient population, is making sure I really think twice, you know, how important is this lab test? When is the last one we've had? Has the child had any symptoms that are indicative of a potential problem? And if, you know, and if the answers are worrisome in those regards, I then kind of lean towards getting them. But for the most part, I've been able to hold off on them. Now, I'm also making a big hope that this pandemic will at least be less of an issue in my state of Ohio within the next couple months. And therefore, I can just delay getting those tests. And so what I've done is I've put them all into the system. And so when the pandemic restrictions do lessen, they're already there for you, so you could go get them done. But definitely have a conversation with your neurology provider and be very clear with them of what your concerns are. We may not all be thinking on the same page as far as why this is an issue. And it's all about limiting exposures and how important that is. Now, we also want to balance and do what's best for the kid. So if your child has had a history of side effects or abnormal liver functions in those medicines, and you need to keep a closer eye on it, then yeah, of course you need to get them done. But in many cases, they can actually be kind of delayed a few months without any problem.
Thank you so much. I don't see any more questions at this time. So if there aren't any more questions, I'll give it a second or two. I just want to thank you so much. Truly, I echo what Robin said. This was phenomenal. I mean, it's really a great opportunity to be able just to have somebody listening to our questions and our concerns. I think that our families appreciate it so much because we don't have as the regular access to our physicians that we normally did in the past. But hopefully that will be, like you were saying, it'll change soon. It'll all go back to sort of normal. And this has been recorded today. So if anybody is interested, if you had to, you know, drop off and come back in, or if you just want to re-listen to some of these things, it will be on our website available to everybody. Dr. Patel, thank you so much for being with us today. We appreciate it so much.
Well, thanks for having me, you guys, and be safe. We love you all.